Dr. Perez, thank you so much for joining us. Lauren, thank you for being here.
Thank you for having us.
Dr. Perez, you're here to discuss how 1 in 8 women will be diagnosed with breast cancer in their lifetime. I found that astounding, so I wanted to talk with you. Can you tell me what is HER2 status means and how it affects the metastatic breast cancer treatment?
Of course, Valder, your premise was absolutely correct. Still, about 1 out of every 8 women are diagnosed with breast cancer in the United States, and breast cancer can also occur in men, although the risk is lower than in women. And out of the approximately 300,000 persons diagnosed with breast cancer in the U.S. every year, approximately 30% of them develop what we call metastatic breast cancer. And that means that the tumor has spread beyond the breast area. When that occurs, specifically the diagnosis of breast cancer, we want to understand as much as we can related to the biology or the characteristics of this tumor to help understand not only the specific diagnosis, but understanding how the cancer may grow and how we can offer best recommendations for care. And one of the ways we do this is by testing for biomarkers. HER2 is one of those biomarkers.
Personalized treatment decisions are guided by these biomarkers?
You're absolutely correct. And this is something that has evolved a lot over the last few years. And HER2 is an example. In the past, we used to refer to HER2 almost like a light switch analogy, either negative or positive. But now research has shown us that HER2 expression is more like a dimmer. In other words, some tumors have lower levels, some tumors have higher levels of expression, and understanding that information, it's very important, and that's why one of the reasons I'm so honored to be here with Lauren and also collaborating with AstraZeneca and Daiichi Sankyo to be able to share this new information.
If you don't mind, I'm going to ask Lauren a little bit about her personal journey and living with stage 4 cancer. Lauren, can you share for us, please?
Of course. Yeah, when I was diagnosed, I was 35 years old. And at first I was diagnosed stage 3. And at that time, I was a young mom. I had 3 girls who were 2, 4, and 6. And the only thing that was in my mind was balancing life as a parent and balancing life as a cancer patient. But soon after my diagnosis, my cancer spread and became stage 4 or metastatic. And at that point, my mental game really shifted dramatically because no longer was this about a short-term battle with a beginning and an end. All of a sudden, this was the rest of my life. It was every day for the rest of my life. And so at that point, I really need to learn to take control, both of my mental health around this disease and living with it, and also of my medical journey and my personal care. And so that's when I learned about my biomarkers, my HER2 status, and started looking for tools that would help me understand these better. And one of the tools I recommend for those living with cancer today, metastatic disease, is HER2statusmatters.com.
Lauren, you share your story so eloquently. I want to thank you for being here on the planet to share your story, because those words you uttered will probably make a difference to a lot of other people. So thank you very much.
I'm glad to be here.
Doctor, is Lauren's story regular or is it unique?
Well, what an important question you are asking. These days, I think we have stories like Lauren that occur more and more often because progress continues to be made. Research is helping us get answers. And one of those big answers includes not only understanding the biology, the biomarkers in tumors, but also help empower the patients to be as knowledgeable as possible so that we can have discussions related to the best path forward.
A place that other people who are listening to this, they may not be walking this path, but they may be the caregiver for someone walking this path. Who knows? Is there a place for them to get some credible resources and some support?
Yes, there's quite a bit of information on one of the websites that we do recommend. It's HER2statusmatters.com.
I want to thank you both for taking the time to share Lauren's story, and I want to thank you, Doctor, for the incredible work it seems that you are doing every day. So thanks for being my guest on the Valder Beebe Show.
Thanks for having us.
Thank you.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.